2023. As you can see, the session is now being recorded, and we will share it out afterwards. My name is Camelia Latte, and I'm the Program Director of Alumni Relations and Special Initiatives at GBHI at our UCSF site. It is my pleasure to welcome you and share some orientation points. Today, we have an information-rich and nimble 1-hour session. To maximize your experience, please mute yourselves. You're encouraged to share questions and thoughts in the chat box. This session is being recorded, as I mentioned, and will be made available afterwards. World Sleep Day was launched as an international event in 2008, and you'll hear more about that during the session. This year, it takes place March 17th, this Friday, and we're celebrating it all week. We celebrate it today, starting with this pre-event. The agenda today is very brief. We will have opening remarks shortly, 2 presentations, a Global Perspectives lightning round and Q&A, and some closing remarks. We have a very full lineup of speakers and panelists who represent both the leadership and the alumni community of the Global Brain Health Institute, including several Global Atlantic Fellows. As you will hear from these speakers, we'd like to remind you that the application for GBHI's fellowship program will be opening soon. You can sign up to receive application updates on our website. I'd like to highlight the 2 co-curators and leads of this session who I had the pleasure to collaborate with, who are very accomplished sleep specialists. The 2 are Dr. Sandra Jimenez from Spain and Dr. Tatiana Mulayeva from Canada. Both Sandra and Tatiana are Global Atlantic Fellows from the 2021 cohorts, and I'll share their biographies in the chat shortly. We begin with special opening remarks prepared by Dr. Bruce Miller, the founding director of GBHI at the UCSF site and the director of the UCSF Memory and Aging Center. And with that, I'm going to stop my screen share. And I'd like to acknowledge my colleague, Winnie, who is leading the technology side of today's event. And Winnie, if you might share Dr. Miller's video, that would be wonderful. Thank you.
Good morning. This is Bruce Miller. I'm a professor of neurology at UCSF School of Medicine, also a founder of Global Brain Health Institute. What a pleasure it is for me this morning to introduce this conference put on by Sandra Jimenez, a brilliant neurophysiologist based in Barcelona, Spain, and Tatiana Mulayeva, brilliant physician, researcher, epidemiologist based in Toronto. Both are leaders in understanding the importance of sleep, its effect on your brain, and helping to understand in a practical way why we need to focus a lot more clinically and in research on sleep. What we have learned over the past decade is extraordinary. One of the things that we have learned is that when we sleep, it is a time when we can get rid of bad proteins, the sorts of proteins that aggregate in Alzheimer's disease. We've learned that during certain stages of sleep, we are actively consolidating memories. And if we sleep in an inefficient manner, it has devastating effects on our day-to-day function. Poor sleep is probably a risk factor for earlier onset of dementia. So these are some of the things that we have learned about sleep. You are going to be participating in an extraordinary conference. Listen carefully. You will remember what is said if after the conference you get right to sleep and begin to consolidate all of the important words that you'll hear. Thank you, Sandra. Thank you, Tatiana, for putting on this very important event.
Thank you, Bruce, very much for that. Okay, and so with that, I'd like to welcome our first speaker, Sandra Jimenez, who again is a sleep expert, a sleep physician hailing from Spain, and is one of our Global Atlantic Fellows. And also just a quick thank you to all the alumni who are joining today and the current fellows, and to mention that there is a public audience for this session, so you are all very welcome. Thank you. Sandra. And just to mention, oh, perfect. Now we see your slides.
Sandra, you're on mute.
Sorry about that. Now can you hear me?
Yes, we can hear you.
So I was saying that I'm sure that you all have heard that we spend a third of our life sleeping, and this comparing with the time that we spend working or eating and being optimist, having sex, it already makes an idea of how relevant sleep could be. There's a Nobel Prize who study happiness that was saying that one of the most things that make us happy or happier was to have a good and bad sleep quality. All animals sleep, despite it's dangerous for them, and we human animals, we also steal a lot of hours from sleep in order to be more productive or to scratch time for leisure. However, sleep always appears, and it makes these differences that the sleep must be something important. If not, it would have already been eliminated through the evolution. So why do we sleep? Sleep is vital. Vital means that we will die if we are not sleeping. And during sleep, there's an amount of function that they are preparing us for a correct function during the day. So it's a period where we repair our cells and tissues that are damaged during the wakefulness period. So we also release some growth hormones. Our immunitary system is reinforced by sleeping. So we do not get the same effect from vaccination if we do not get enough sleep. And we have many other functions. But as Bruce was saying before, so one of the most relevant functions of sleep is that sleep is essential for memory. Unfortunately, we cannot learn a language just by listening and repeating to it while sleeping, but we do know absolutely that if we learn, we are preparing for an exam, this learning is going to be significantly improved with a night of good sleep. And this research has shown us that the sleep is important before learning, because we need our brain to put an optimal attention to try to learn these new memories. Sleep is also important to consolidate these memories, which means to transfer these new memories into our brain's long-term store of memories, our cerebral cortex. And with this, during sleep, we are arranging our memories in terms that is more easy to remember than in the next morning. But also during sleep, there's a connection with different memories, which explain why we can wake up in the morning with a solution of a problem that we didn't have before. Sleep participates also in the emotional regulation. And again, I'm sure that you all have experienced that after a night without sleeping, you feel irritable and answer more hyper emotionally for any stimulus. So this is in part because in the regular inhibition that exerts the prefrontal over the amygdala, which is the brain center that controls emotions of our brain, is lost or is decreased with a situation of sleep deprivation, which this means that this balance is break and there's an overactivation of the amygdala, and so we have our response. Also, during sleep, there's a progressive reduce of the affective reactivity that go with the memories. So at the end, we have only the memory content, but we can, after several nights of sleep, we are able to evoke a memory, despite it was very emotional, but not or without feeling these emotional feelings. So just an advice, if you have a problem, try better to sleep on it, you will feel better, and maybe you will find the solution for that problem. And finally, but really important, is that we recently discovered that the brain cleans during sleep. So our lymphatic system, which is the garbage brain system, is sweep the debits that are accumulating during the wake period and throw them away. And there are 2 points really important. One is that this system is working during a slow sleep. And the other is that some of these waste products are proteins that are related to Alzheimer's disease and other dementia. Therefore, if this lymphatic system is not working properly, maybe because we don't have enough sleep, because we have sleep disturbances, these metabolics can accumulate and therefore accelerate the progression to dementia. So keep in mind that sleep, and to keep an optimal quality of sleep, especially slow sleep, is a good dementia prevention. So right now, I hope that no one has doubts that the sleep is not a part of dying, and is a process of brain activity related to wake. And it's until 19th that together with the discovery of the electroencephalogram, that we know that our sleep is divided into 2 stages, non-REM sleep, non-REM sleep at the beginning of the night, and REM sleep at the end of the night. And non-REM sleep is also divided into more superficial sleep and deep sleep or slow wave sleep. But this architecture is not preserved across the ages. When we are newborn, so we have the highest REM percentage, because we need to do a lot of synapses, we have to learn a lot of things, and our slow sleep also decrease exponentially while aging. So you have here the difference of percentage of slow sleep across ages, and our period of wake time also increase with aging. Our circadian system change, and we fall asleep and get up earlier, and we start disrupting this circadian system. So we start having more daytime naps, but we have a more nocturnal disruption, and means that we our sleep pattern, interestingly, resemble when we get older, looks like this irregular sleep pattern that we have in infancies. And then I will like to join you to answer this question.
And the question is, why is sleep important? And there are 6 responses. We'll wait a few more seconds as we have 59% participating, 63%, 65%, and we'll end the poll in 5, 4, 3, 2, and 1. And here are the results.
Well done.
And now, after Sandra, we will be hearing from Tatiana Molayeva, who is our second speaker and the co-lead of this session. Again, Tatiana is from Canada and from the 2021 cohort, and she is also a sleep specialist. Welcome, Tatiana.
Thank you, Camelia. I'm not sleep specialist, but certified in sleep medicine. Thank you so much.
Thank
So I will talk about how sleep is regulated. So to understand what we can do better to be able to preserve these both processes of sleep. So there are two processes of sleep according to Barbelli, which was introduced in 1982. Process S, which is homeostatic process or sleep pressure, which states the longer we stay awake, the more intensely we will sleep. This is reflected very accurately in the amount of slow wave sleep we have, and which is the most restorative state of sleep. And second process is process C, which is called by its name circadian process, which is internal to our body, which is our internal clock and is generated by the clock in the hypothalamus, in particular suprachiasmatic nuclei. Process C modulates the timing of sleep episodes by setting for us upper and lower thresholds as seen in this picture. And when either of these lower or higher thresholds are reached by process S, which is homeostatic process, a sleep episode is either initiated or terminated. There is science behind this. It's not that someone sat down and said we have two processes. First, homeostatic as a concept was introduced by Conan in 1929 and was published in his book, The Wisdom of the Body. In 2002, Tanoni proposed the homeostatic model of synaptic homeostatic sleep model, noting that waking state and our activity during wakefulness is associated with synaptic potentiation in many brain circuits. This synaptic potentiation requires a lot of energy and space, and it saturates the brain ability to be energetically sustainable. So we need to do something about it, and brain dysregulates the synapses and undergo process called synaptic downscaling, which occurs in sleep. This is a feedback response to reduce firing rate of neurons that are involved in arousal. So this is reflected in how brain functions during sleep. As you can see in these pictures, several brain areas are reducing its activity of firing, and these areas are seen involved in arousal. Glucose metabolism of a brain decreases significantly during non-REM sleep as compared to wakefulness. In fact, in deep sleep, up to 40%. In REM sleep, the situation is different. Activity of the certain areas, however, remain active, and these areas are limbic areas system, which are in close proximity to ventricular system, which is involved in removing waste products. However, prefrontal cortices are still reduced in its activity. Now that we learn about process S, or homeostatic drive for sleep, we'll talk a little bit about science behind process C, which is regulated by our circadian or biological clock, and which has firing rate of neurons of approximately 24 hours. And it's entrained to day and light and dark cycle. The timing of the circadian rhythm is influenced by the environment. All body functions, such as hormone production, body temperature, follow this fluctuation of the circadian rhythm. One of the hormones is melatonin. We know most about it. It is known as a sleep-promoting hormone, which is released in response to darkness, but is suppressed with light. Two processes operate independently. However, they reinforce one another. And so, process S reinforces process C much greater rate than the other way around. Ideally, those two processes should work in synchrony and reinforce each other so our body systems are kept balanced. To move away from these processes, but not fully, I will introduce the concept of sleep health. What can be done for us to maintain these two processes in synchrony? There are many different ways to measure sleep health. The simplest one is proposed by Bussey in 2014, as can be seen in this questionnaire called SATED, based on first letters of important items that are introduced here. It's satisfaction with sleep, alertness during waking hours, timing of sleep, efficiency, and duration. If you respond to these questions, you will be able to calculate your own sleep health score, which indicates 10 as a good sleep health and poor sleep health at the rate of 0. What can you do? Basic sleep hygiene help here. If you will look carefully at the items within basic sleep hygiene, you will see representations of processes that reinforce synchrony between your circadian and homeostatic processes. This, in turn, will enhance brain health and through sleep health, and will enhance factors that are involved in sleep health: satisfaction with sleep, timing, efficiency, duration, and next day alertness. Now I will want you to reflect on what I spoke about and answer this question. Thank you for being active participants.
And so the question is, which of the following is not reflected in the SATED's sleep health concept? And there are several answers. And we'll give this a few more seconds, counting down at 5, 4, 3, 2, and 1. Okay, let's see our results. There you go, Tatiana.
Thank you very much. So majority are right to the point, sleep deaths.
So now let's move on next section. And we are transition to the global perspective lighting rounds. And it's my honor to present the panelists that are gonna join us in this section. There will be times for the audience to write or to comment more questions. So I will put the bibliography as well in the chat if you want to share them. And so let's start with the first question. Okay, I can see here. So I can see only now. Oh, okay, now.
Feel free to keep going, Sandra, and the additional speaker will be added very soon.
Okay, thank you.
Yeah.
Okay, so it's my honor to present Neus Felgas. She's a brilliant research neurologist from Barcelona and a physician as well as clinical neurologist from Indonesia, and Dominic Gailel from actor and writer from Ireland and UK. Thanks for being here. And I have a question for you regarding this sleep and brain health. And it's, what are the common misperceptions that people have about the sleep and brain health? How can we combat them and communicate more effectively? So, Neus?
Yeah, thank you, Sandra, for this kind introduction. Hi, everybody. It's very nice to see so many familiar faces in the boxes in the Zoom. Well, I think that one of the main misconceptions that relates to all the theory that you have talked about before is the idea that sleep is perceived as a period of time in which our minds and bodies are resting. So they are kind of doing nothing. They are not performing any relevant activities. And we should first change this conception to become more aware of the potential of sleep as a tool for diagnosis, as well as a tool for preventing diseases. We should disseminate more about how sleep is a biological necessity and how insufficient sleep or untreated sleep disorders can become detrimental for health, especially in brain health. And that's why this is especially important for the field of dementia or neurodegenerative diseases. But sometimes I wonder how to spread the word. I think that we should be capable of disseminating specific and clear ideas or tips based on scientific knowledge and consensus. But I feel, on the other hand, that we have still a lot more work to do in regards to know better about how sleep works in aging and also neurodegenerative diseases. So probably we need to do more research to fill the gaps before we can be able to disseminate more effectively the tips or the guidelines that we want to spread. For instance, I think that we should know a little bit better the neurobiology of sleep in normal aging or healthy brains, but also how this neurobiology of sleep changes in each of the neurodegenerative disorders, and what are the particular mechanisms or the underlying the memory and cognitive processing while we are sleeping, and how these processes changes when we have a neurodegenerative disease, and how neurodegenerative disease manifests the sleep alterations, and what is the neurobiological translation of that. So I don't want to stand because I think that we are tight on time, but we need better knowledge on what is the natural history of sleep in all ages, and also when we should consider sleep problems as a risk factor that could eventually impact in brain health, and when this may be the first symptom of a neurodegenerative disease that is still to come. I don't know what you think, guys, but I think that research is key to advance on this field.
Absolutely agree, Nelson. Thank you so much for this dissertation. What about you, physician? What do you think?
Thank you, Sandra. Hi, it's so nice to see you all. And thank you, Tatiana. Thank you, Sandra, for including me in this amazing event. I think the first thing I would like to highlight before addressing to that questions that it is very interesting that despite the advances in the science of sleep, there are still misconceptions about sleep. And I think it remains common to find these misinformations because it is spread by word of mouth or online on social media. And this misinformation becomes repeated and spread so frequently that it becomes a widely circulated myth, then it's considered a fact. I think it's one thing to remember when we try to find a way how to combat these misconceptions. And I think what I'm about to share here are probably the things you all might have heard quite often, but I think it's still worth mentioning them here. The first example of misunderstanding among lay people here is very similar to what Niels, I hope I didn't misspell your name. What Niels has that the brain stops working during sleep. So it's like a common concept here that the brain shuts down during sleep. And this, I think this fact more or less causes people not to care too much about the quality or the quantity of sleep they have. While we know like the fact that the brain remains active during sleep, like you have clearly explained that, Sandra, with different activity patterns that change during different stages of sleep, and very important for memory, learning, and emotional regulation to our well-being and quality of life. But I think although the brain remains active during sleep, it also takes time to complete the various tasks that keep the body healthy. So the brain can function optimally with a consistent sleep schedule. And one, I think NIST has provided a very important concept on providing educations. And I think the one way to avoid misunderstanding is, of course, to increase education about the importance of good quality of sleep and its relation to health in general, and also in particularly in brain health. And for example, in what I have in mind is in the work environment, we have to fight the stigma that sleep deprivation because of work, it's something to be proud of, that we need to stop glorifying sleep deprivation due to overwork, because we know the fact that it's sleep deprivations can reduce productivity. I think I can go on about this, but I think we have to very aware and conscious of the time. So I'm going to stop there first. Thank you.
Thank you so much, Patricia, for your reflection. This was great. And we would like to hear you now, Dominic.
Thank you, Sandra. Thank you, Sandra and Tatiana, for inviting me along. It's wonderful to be here and to see you all. I had some thoughts about communication and about how sleep connects us through time and society and geography. A week ago, I climbed a hill and I stood by the ruins of a stone burial chamber. The original occupant had been placed in this tomb about 3,000 years ago. The entrance had been sealed with a colossal piece of limestone. And once darkness finally fell on the occupants, depending on their belief system, they either began their journey to the next world or they slept for eternity. In written and spoken English, sleep is a magnificent metaphor. We talk of sleepwalking to disaster, of falling asleep at the wheel. It is an activity that foreshadows calamity through negligence and hubris. William Shakespeare writes about sleep when he writes about death, to sleep, perchance to dream. When he writes about conscience, Macbeth hath murdered sleep. When he writes about rejection and disillusionment, thus have I had thee as a dream doth flatter, in sleep a king, but waking no such matter. Who gets to sleep? Sleep is the currency of the lucky, keeping them in psychosocial credit. When I was 8 years old, a boy joined our class at school and he would fall asleep every afternoon. Our teacher wouldn't let us wake him, an act of uncharacteristic generosity. A few years ago, I lived with a friend of mine on a social housing estate on the north side of the River Thames in London, the land of extreme inequality and super gentrification, a place that was once home to a government fairness commission. On this housing estate, a residential tower block sits, its 12 stories unbalancing its surroundings like London's division of wealth. The tower block blots out the night. 2 streets and several light years beyond it, rows of handsome Georgian houses set back from the road lazily continue their effortless upward trajectory in value. These houses are virtually silent. The tower block is never silent. It is too densely populated. Its walls are too thin. A utopian vision of the 1960s promising dignity through provision of indoor hot running water, but built without an empathetic comprehension of community by those who were never going to actually live in them. Unsustainable even in the medium term, thousands of these blocks were built. Some were destroyed, but others, like this one, were refabricated and replicated throughout the country, too hot in summer, too cold in winter, sweeping up the hope and despair of millions of people and distilling them, squeezing them, dangerously unmaintained and unforgivably ignored. I once dreamed that I heard crying from somewhere on the tower's upper floor, then from a different window and another, a weird symphonic discordance. In my dream, I stared in horror at the tower, panic rising, unsure of what was real and what wasn't, frozen in place. I often envy those who do not dream, or more accurately, do not remember their dreams upon waking. I am one of those people for whom a dream can be so vivid, its emotional impact so residual, that it may be the shadow within which the entire day is shaped. Trying to describe a dream can in itself be an act of diminishment, like trying to describe a scent. It is more impactful to talk of how a dream made us feel than the action it contained. Within a dream, the simplest, slightest imbalance of the prosaic can overwhelm us. Within a dream, we may be exultant or exhausted or existentially terrified. And if nothing else, we have this in common with the occupant of that ruined stone burial chamber. In life, 3,000 years ago, they also dreamt, like we do, an imaginative connection, and one from which we can imagine in their pre-industrial society, they awoke feeling more refreshed than we do today. Thank you, Sandra.
That was amazing. Wow, congratulations.
Now we will go to a second part of panelists who join us today. Thanks to them. Those include Mutoni, who is medical gerontologist and researchers, and who is a global fellow with the Global Brain Health Institute, coming from my cohort. Elisaya, who is behavioral and sleep neurologist from Greece. Yu, who is epidemiologist from China, and Jenny, who is neurologist from Venezuela and Israel. So, and we will try to address another question in this panel, which is as follows. I want to ask participants and panelists to reflect on the following questions. In your experience in your country, and you're coming from different countries of the world, what is one way to advance sleep health at the level of a person and society? Thank you very much for taking a leadership in answering this question. I want Mutoni from Kenya to start the discussion. Thank you.
Thank you very much, Sandra and Tatiana. This is quite exciting, and I keep telling people one of the things I love doing is sleep, and some way, somehow, I hope I communicate. So responding to your question, the one thing I would actually look at is education and awareness. And why is this so? Because chances are very high that many people in my country may not be aware of the importance of good sleep habits, or on the other side, the negative effects of poor sleep. And to me, increasing education and awareness is likely to impact on their practice. And what does this mean? That people will understand the role of sleep in the overall health and well-being. And some of the approaches that we could use in educating and increasing the awareness would probably focus on providing information at all levels. And this could include the community-based workshops, which would focus on the benefits of sleep, the risk of poor sleep, and the strategies for improving sleep hygiene. And this could be delivered by community health volunteers, community leaders. Again, there is a big opportunity to leverage on digital platforms. Previously, Fifi talked about how it is that information is dispersed on social media, and it can end up being a myth. But then on the other side, there is a huge opportunity to be able to deliver accurate information and message in campaigns, and there's a chance of reaching a broader audience. It is also important to recognize the unique cultural context in my country. For example, in some areas, children sleep with their parents, and how does this impact on their sleep? That means that we need to implement campaigns that would increase the reach and effectiveness of the education awareness. And at the end of it, we need to utilize the various communication channels that are available while emphasizing the contextual and cultural appropriateness of messaging. For example, by emphasizing the benefits of good sleep for productivity, energy, and mental health, which may be effective for the communities in my country. While doing all this, it is important to also remember to monitor and evaluate the impact of the messages and the information that we give to the community. Thank you.
Thank you very much, Mutoni. It's amazing discussion at the level of the population. And I would like to invite you, who is an epidemiologist from China, to continue discussion at the level of the population. Thank you so much.
Sure. Thank you very much, Sandra and Tatiana, for organizing this and for inviting me. This is really exciting to see so many folks still interested in sleep. I think we kind of got it started with Jenny, Alessia's both on this panel and a few others a few years ago. And we are really excited to see this continued interest. And I'm currently based in the US, but you know, I'm from China, and I'm kind of very I guess I'm familiar with the problems, the sleep epidemic in China that we're facing now. I think one of the biggest problem is the 24/7 society. I'm not sure if some of you have been to China, but you have been, you will be amazed at how many activities you can have throughout the night. So basically there's the country never shuts down. I think both work and also entertainment, and there's just so much to do the whole time. And you can order like takeaways in the middle of the night, which is, I guess, impossible in many other places. But that also causes a lot of sleep problems that and I think people are also kind of staying up during the night, and they have to always be responsive to work messages, and it's kind of the clocks just keeps ticking. One thing I think is worth mentioning is kind of in Chinese medicine, we do have this kind of in a day we have the 4 times. It's called the 4 times. So it's a way to keep you healthy, and that emphasizes kind of the circadian rhythms. And part of this is we take naps during the day. So basically it asks you to wake up early, go to bed early, but also kind of taking a nap to recover your performance in the middle of the day. It's usually, I think it's between 11 a.m. to 1 p.m. That's because the Chinese hours usually by every 2 hours in Chinese medicine. So during that time, I think it might be similar to some of the Mediterranean cultures where you also take siestas. But in China, I think in that habit also starts to, go away now with the work stress. Having said that, I think in older adults in China, they still have, when they have, more flexibility, when they have more time, less work commitment, I think, they are, I guess, less affected by this sleep epidemic caused by the work stress. So I think that's a good thing. And I think finally, just from the therapeutic point of view, in China, there is really no sleep medicine specialty. It's kind of a collaborative effort by respiratory, neurology, psychiatry, kind of just different multidisciplinary effort. And I think there is an increasing attention given to increase sleep medicine, both education and kind of practice in China. And I think that's really important for this. Thank you.
Thank you. Now I will move to clinicians, and I would like Jenny to comment on this question at the level of a patient or person, individual level. Thank you.
Thank you very much, Tatiana, and thank you very much, Sandra, for keeping us going. So I am a neurologist, like you said when you introduced me, but during my 5 years in San Francisco, I managed to spend a year at Stanford and get my board certification in sleep. So since I returned to Israel, I've been seeing patients. And it's been a very interesting experience because I see 40 patients per week, which means that there's a lot of need for sleep medicine. However, sleep medicine is not a recognized specialty here in Israel, and I actually believe that it's not in Greece either, Eliseus, from what we were talking. So there are a bunch of pulmonologists mainly that took upon themselves to start this specialty already like 15, 20 years ago. There's over 20 sleep labs in the country, but there are no doctors that specialize in order to read PSGs, and the technicians that do the polysomnogram, the sleep studies, are also not trained for it. So it's very much something that they learn along the way. So of course, the quality of these sleep studies that are performed over these 20 labs, it's very much a question mark how good it is. That being said, I do feel there's a lot of interest on the patients in order to improve their sleep quality. And I do think that patients are starting to become aware of how important it is to sleep. The problem is, like Yue was saying, in China, I do feel that Israel is also a place that it's open 24 hours a day. And even myself, I'm a sleep physician, like I said, and I don't manage to sleep 8 hours a night. Because I'm supposed to be at my job at 8:30, but then I have 4 kids that I need to take to school before that. So kids' school also start at 8, which we know that it's too early. And actually in the United States, when I was there was an effort to change the school starting times, and it was moved, at least in California, to 8:30 instead of 7:30 or 8. But here, if you try to do that, as much as parents are aware that it's a problem, they say, no, you need to start at 8 because I need to be at my job at 8:30. So, and then after that, they get out of their job at 4:30, 5, and then they need to pick up their kids and take care of their kids. So until they're done, we don't have enough time to fit to our responsibilities. And it is a problem. So I do feel that society is demanding from us more than we can give. And then we have all other health aspects that we should do, like, oh, you need to exercise every day 30 minutes at least. And you should also meditate so you won't be stressful. And everyone says, no, you can do that. It's only 10 minutes. It's only 30 minutes, but it adds up. So we need to decide as a society what our priorities are. So I think that demanding that from the patient, it's actually too much. I think that we should have policy changes. It all comes down to policy once again. So I do feel that we need to decide how much should we work, how many hours should we work, should our WhatsApp be open all the time to answer to questions whenever our boss feels that we should answer? Like, what are our responsibilities and what's the circadian rhythm of our responsibilities? When is my responsibility to sleep and what time of the day is my responsibility to work? So I do feel that the patients are aware. I do feel that the patients, like I said, see 40 patients a week, and still my clinic has over 6 months on waiting times. It's very impressive that it's here, at least in Israel, we're less than 5 neurologists that have done sleep abroad. So it's just starting to become a brain issue. It used to be only a lungs issue. We're starting to understand that it's more than that, but we need to push higher up the chain to the people that can actually make it, like, have an influence on a population level.
Thank you so much for connecting in level of individual and level of society. That's very important for global leaders in brain health. I would like to move and invite Elisa to discuss this question from his perspective. Thank you.
Thank you, guys, and thank you for the invitation. I completely agree. I was thinking of the question and taking a step back and thinking of the framing it. Practically, we're talking about a question of scalability, and that means if you consider the different actions that you want to achieve, or what the different goals. So you want to achieve better clinical outcomes, which means you need also research, you need education, as Tony mentioned, you need policy changes, and there's different components now to that. To reach the largest amount of people who pursue their lifestyle, but also get earlier diagnosis, more accurate diagnosis, more complete diagnosis, and then they get the best possible treatments, means that on a healthcare system level, you need policy changes that Jenny mentioned. So for example, in Greece, as in Israel, the sleep physician is recognized as existing, but they don't have professional rights as sleep physicians. Only pulmonologist or neurologist rights. There's no fellowship recognition, and it goes beyond sleep medicine. So that's a fundamental policy issue. We're actually pursuing that also through part of a common project we're pursuing with other GBHI fellows, and I'll mention that. But as an instance in Greece, in getting some changes done. So for example, that part in recognizing equity for the rights of sleep physicians, irrespective of underlying specialty. And even a case I presented some maybe a year ago or so at the GBHI cases indicated exactly that, that a pulmonologist was not an expert in making a proper diagnosis and treating a patient with ALS who was hypercapnic and was having problems, and diagnosing them with sleep disordered breathing. Similarly, not every institution is able, the mentality here remains on a policy level that you should go into a hospital where you're increasing your risk of getting COVID or other infections to do a sleep study. The mentality of go and have a home sleep test, for example, for a simple sleep apnea doesn't exist. Also, the legal setting mentions that things that increase cost, for example, are like a sleep test in insomnia, which is not indicated for insomnia, that people can prescribe that. So you have people exploiting the system simply because policy is not optimal. So we're trying to change that. Then you want to achieve scalability on a level of assessment, and that's where we're also pursuing, together with Sandra, Ophir Kiret in Israel, Emily Adrian over in Edinburgh, and also Konstantina Sikara here in Greece, through the Mesco-Brady Horizon project, which has one more year of life until its completion. So through that, we're developing exactly platforms that Tony mentioned, that are platforms of multidisciplinary access or entry of different types of data, real-world data, that include wearable devices, include sleep studies, include TAPCAT data, and getting into deeply phenotyping people. And to do that, and doing that, towards doing that in a personalized manner, so that you minimize cost, but also you get rich data that can allow better diagnosis across the currently 6 main categories of sleep disorders, and allow for a faster diagnosis and across the conditions. So people that have sleep problems are more likely to have cognitive problems or epilepsy, which are our main groups, but also other medical conditions. And all that relying on diagnostic tools and expert systems of decision-making that have to do with artificial intelligence implementation. So we're developing that, and we're talking about large projects across Europe and Israel, and hopefully expanding them across the globe. So it's a match of social sciences as far as policy making, and technology and expertise and research that will advance that. That's my view. We just have to keep on at it.
That's such a comprehensive discussion. Thank you so much for that, and for the initiative and connecting global leaders in brain health within this initiative. Hopefully together we can reinforce the message of the necessity of sleep medicine to be in each and every country, a recognized profession, and with that improve brain health and overall health at the level of a patient and the level of society as a whole. It was amazing panelist discussion, and I would like to ask Amelia to continue with the closing remarks. Thank you.
Thank you so much, Tatiana. And thank you to all of our speakers. That was amazing. And I was especially struck by the interdisciplinary nature of your collaboration together. I'm going to share in the chat a few links. We apologize for the shortness on time. And we really appreciate you sharing your questions in the chat, which we hope were answered fully by our speakers. If not, feel free to follow up with either me or them to answer some more. I'd like to first give a very big round of applause to all of the speakers before we invite, so a round of applause. Thank you very much. Thank you so much, you all. And now I'd like to invite our wonderful site director of GBHI from Trinity College, Brian Lawler, to share special closing remarks with all of us. And again, please do share your feedback with us in the link that I've just shared in the chat. And Brian, you are very welcome. Thank you for being here with us.
Amelia, thanks so much. I mean, what a wonderful session. And I think this is really the magic of GBHI. And we really heard some diverse perspectives on sleep. And it's really impossible to capture this in a couple of minutes, the richness that I heard. But I'll try and pick up on a couple of points. I mean, I thought, first of all, on really what did I know about sleep before this? Probably very little. But I mean, as a psychiatrist, when I think about sleep, I think about dreams. And, you know, dreams being the royal road to the unconscious. We heard a little bit about that from Dominic. But sleep and dementia, I mean, I was struck by, again, you know, when you're dealing with people who are living with dementia and disturbance of sleep, how difficult it is for people with dementia, with sleep disturbance, and the poor tolerability for caregivers, and how sleep disturbance in people living with dementia is such a risk factor for institutionalization. And then sleep and depression. I mean, for me, sleep disturbance, it goes hand in hand with depression and, you know, early morning waking, middle insomnia, and even initial insomnia. These are features of depression that are so disturbing, so distressing, and risk for suicide. So that's really where I came to this webinar. But I mean, I've learned so much. I mean, there's so much new information, so much rich new information. So, for example, I mean, coming away from this, I mean, I'm struck by how essential sleep is for brain health, and how we need to really promote sleep hygiene, sleep health from that perspective. And we heard a lot about how we need training and education and awareness, you know, in every country about this. I also learned about sleep and memory consolidation, and I was pretty struck by the narrative around learning, how sleep can enhance learning, and how there is the development of interconnected ideas. And this kind of spoke to me of creativity and how sleep can stimulate creativity. And we've just finished with Creative Brain Week and creativity. And I think there's a lot to be learned from this. But again, I heard more research. I mean, what is the mechanism? Can we learn more about the mechanism? Can we enhance creativity through sleep health? Links with dementia risk are really important. I mean, this is something new now, and it's something really, really important, that sleep disturbance is a risk factor for dementia. And it sounds like the inability to clear toxins, including A-beta, from the brain during periods where people do not have good sleep health is important. Again, this is a point of intervention. We heard a lot about the challenges of trying to enhance sleep, and again, we heard about inequities, social determinants, the environmental determinants, all of which can affect sleep quality, and the 24/7 lifestyle and the stress and problems that we all have, which are working against sleep health. So the solutions appear to be not just downstream, but very much upstream, looking at structural and systemic changes, dealing with inequities, looking at policy, because if we're really going to make a difference, we really have to promote sleep health across the life cycle very, very early on. And again, I think GBHI is ideally positioned. I mean, we have the different professions We have, people from arts, humanities, from the sciences. So we have the professional repertoire to deal with this, and we have the leadership. And I'm so delighted to see these leaders here today, coming from this sort of special interest group from GBHI who are driving this agenda forward. And I just really want to just conclude by thanking Camilla, for emceeing this, but also Sandra, Tatiana, Nus, Fifi, Leseas, Mathoni, Dominic, Yue, and Jenny for their wonderful contributions. I mean, I think this is a fantastic initiative. I hope we can do more of it. I think this is the way forward, just to highlight a topic like this. And it's really the sweet spot for GBHI, and long may it continue. So thank you very much. Just hand back to Camilla.
Thank you, Brian, so much. And it's wonderful to hear those closing remarks. And everyone, we're so happy to see you here today. It's such a delight to see our Global Atlantic Fellows from all around the globe, truly from all different cohorts. We wish you very good sleep and a wonderful day. And if you're new to the GBHI community, please do engage with us. Go to our website. If you are interested in the fellowship, talk to one of our fellows, our global fellows, learn more, and you are all very welcome. We will have more events coming up. Check out GBHI's event page. And such a pleasure again. Thank you, Sandra, Tatiana, and all of our speakers who are immersed in sleep. Thank you very much, everyone. Sleep well later.